Today we have Dr. Murali Subramanian with us. Dr. Murali Subramanian is a senior medical oncologist and director of daycare clinics at HCH Enterprises. Welcome, sir.
Thank you.
So, being a medical oncologist, and the question which comes to our audience mind is about chemotherapy. So, can you enlighten our audience about what chemotherapy is?
Yes. So, usually for any cancer, there are three important modalities of treatment. It's surgery, which involves removal of the tumor, then chemotherapy, which are basically medications, and then radiotherapy, which is radiation treatment. Now, chemotherapy is an integral part of most cancer treatment now. So what chemotherapy does is these medications, they act on rapidly dividing cells. And as you know that cancer tumors are known to divide in a fast way, that is in a rapid way. So chemotherapy medications are designed to affect these rapidly dividing cells. So generally these chemotherapy medications can be given intravenously, that's the most common mode. In some occasions these medications are given orally also.
So I'm sure a very important factor which, and the question which you also must be coming across in your routine practice and which people are quite worried about is about the side effects which are associated with chemotherapy. Can you throw some light on that?
Very important. See, that's the most important thing that the patient thinks about. So what is in it for me? Like what are the side effects following this therapy? As I said that chemotherapy affects dividing cells, right? So normally also there are dividing cells. These normally dividing cells can be in the hair. These normal dividing cells can be in the what we call gastrointestinal system. These normal dividing cells are blood cells, are also part of a normally rapidly dividing cells. So chemotherapy tends to affect these rapidly dividing normal cells also. So hence we have the side effects like hair fall, sometimes ulcers in the mouth, drop in blood counts, fatigue, nausea and vomiting. So these are some of the very common side effects which are seen. The beauty or the best part of these side effects are most of them are temporary. Like they are there mostly during the cycles. Most cycles are given at 21 days intervals. Most of these side effects will last for 3 or 4 weeks, but then many of these side effects settle down within a 3 to 4 weeks period. Long-lasting side effects are very rare in chemotherapy. So that's the message I want to give. Yes, chemotherapy does cause some temporary side effects. That should not make people get scared from taking this treatment because long-lasting side effects are very, very less.
That's important. That's very important for everyone to understand. That it is important to take chemotherapy and the side effects are something which are not common for everybody, and long-standing side effects which are something which we can battle easily. Thank you so much for that, sir. So, sir, in past decade or two, we have seen some advancements in medical oncology, which means in the kind of medications which have come up to treat cancer. Can you throw some light on this aspect for our audience?
Yes. So, as I said, conventional chemotherapy comes with a bag of side effects. So, they are very important component of treatment. Chemotherapy is here to stay. They will always be there. But these novel therapies are added to the conventional chemotherapies, or sometimes these novel therapies are given on its own. So, more and more today we are seeing that an independent treatment with a novel therapy or a new therapy is sufficient to control or cure a disease. So many of these newer treatments targets a specific protein in the cancer cell, which can be either on the surface or the inside of the cell, or some of these newer treatments targets the immune system itself. So broadly, the newer therapies targets these two important mechanisms. So and these treatments are getting simplified with every passing day. So there are many treatments. For example, for a disease like what is called as chronic myeloid leukemia, a disease for which the only answer was bone marrow transplant a decade or two back. Now it's been transformed into a simple oral pill, and the drug is imatinib. It's a wonder drug. So that's how the field has transformed from a disease which required a therapy like a bone marrow transplant to an outpatient oral pill. So these are the newer therapies which are emerging, and there are many more which are getting added to the basket. Yeah.
So I think there is something interesting which we can share with our audience over here, sir, since we are talking about targeting certain type of proteins in the cell. So can you throw some light on targeted therapies, on these therapies?
Yes. So the very name, as it signifies, you are targeting something. So targeted therapy simply means that you are targeting something. What is that you are targeting? You are targeting a protein which is either on the surface of a cancer cell or it is in the interior of the cancer cells. So these protein could be the abnormal protein which is triggering the entire cancer process. So specific medications are given to target these abnormal proteins. So some of them they act on the surface of the cell. They are basically large molecules, and these are called monoclonal antibodies. But many of them, they actually sneak into the cell. The therapy sneaks into the cell and tries to target these proteins within the cell. They are called small molecules, or a technical term which is used is called tyrosine kinase inhibitors. So most of the small molecules are oral medications. So it is a very simple therapy, oral medication, whereas the large molecules are the intravenous monoclonal antibodies. So basically the large molecules require admissions and daycare process, whereas the small molecules is just like an outpatient treatment, how a hypertensive or a diabetic receives a pill. So these are outpatient treatment. So the biggest plus point or an advantage is the side effect profile of this targeted therapy is entirely different and more favorable. Like, as we said, the side effect of conventional chemotherapy is hair fall, nausea, vomiting, fatigue, drop in blood counts. Many of the targeted therapy, they do not have any of these side effects. So they do come with some side effects, but these side effects by and large can be managed. Yeah.
So there is another interesting modality of treatment which in past few years have emerged and helped a lot in managing cancers, which is immunotherapy. I'm sure a lot of our audience must be interested in knowing a lot about immunotherapy. Can you please throw some light on it?
Yeah. So this is a buzzword in medical oncology, that immune therapy. So many of the patients do walk into the outpatient and then ask, am I eligible for immune therapy? So they have read a lot about immune therapy. So there's a lot of information which is available. Yes, it is the new kid on the block, and it is showing promising results in oncology. So basically there is a complex interaction between the host immune system and then the cancer cells. So normally a host immune system, if it is robust, it should be able to handle these cancer cells. But these cancer cells, they find a mechanism to evade the host immune system. So this is central to the whole therapy of immune system. They try to evade the entire immune system. Once they evade the immune system, then they have the capacity to spread to distant organs. So the whole therapy of immune system is how to potentiate one's own immune system against cancer cells. So there is an existing immune system which is already there, which may not be robust against the cancer cells. So the whole therapy of immunotherapy is all about potentiating the host immune system against the cancer cells. So usually these immune therapies are by and large the large molecules. As I said, these are the monoclonal antibodies which are given intravenously. So broadly, they are called as immune checkpoint inhibitors. The technical word what they use is the immune checkpoint inhibitors, and these are the most important line of treatment as far as immune therapy is concerned. So there are other types of immune therapies, like vaccines are also part of immune therapy. There are other monoclonal antibodies. So they also form the gamut of the immune therapy, gamut of immune therapies. So not all cancers, respond to immune therapy. So and there are specific cancers which have shown to respond better than other cancers. For example, melanomas, the skin cancers which are melanoma, then the kidney cancers, the lung cancers. So all these cancers have shown to benefit much better with the immune therapy. So practically today, any tumor can be treated with immune therapy, but there are specific tests which has to be done on the tumor tissue, which has to be checked on the tumor tissue to see that whether the patient is eligible for an immune therapy. So don't be under the impression that all the patients are eligible for immune therapy. There are certain important tests which have to be done to determine whether the patient is eligible for immune therapy. But it's a very exciting treatment in medical oncology.
So, can these treatments be given in a properly equipped daycare centers?
Yes. Most of these treatment, be it chemotherapy or the targeted therapy, could be finished in daycare centers. But the thing is, it should be properly monitored by an expert oncologist. It should be given under the guidance of a specialist. So that's the most important thing here.
Thank you so much, sir. Thank you so much. I'm sure that the audience who are listening to us will definitely get benefited with this information. Ladies and gentlemen, if you have any further questions or comments, don't forget to write us in the comment box below. Do take very good care of yourself. Thank you so much.
Thank you.